Hi, welcome to Division C. My name's David Cleave and I'm the Head of Nursing, and I'm joined today by
Angela Coop, one of the Deputy Heads of Nursing who work alongside David and another colleague as Deputy Sarah Randall.
Hi, you're about to hear from a whole range of amazing colleagues within Division C. I'd like to take a couple of minutes just to introduce you to the division. So we are a huge mixed division of medicine and surgery. We've got well over 1,000 staff, about 950 of whom are nurses at the moment. We have specialties across about 26 clinical areas at the moment, and so we see a really broad range of patients, and we have a huge number of opportunities for staff who want to work in our division. My role as Head of Nursing is really to make sure that there is a plan that we're following, that we've got a sense of direction as a division, and to make sure that we're giving the best possible care to patients that you would expect from a world-leading organisation such as CUH. The other part of the role, I guess, is to have a strategic vision and to make sure we're following our values. And it's probably worth just mentioning one of those values, which I hold really dear, which is part of the CUH values, which is kindness. And it's something that I really want to make sure defines everything that we do as a division. And what I'd hope to see is that anybody who joins our division will experience kindness from day one, and then it will characterise their whole stay. So that's probably enough from me. And I think what I'm going to do now is hand over to some colleagues from our Department of Medicine for the Elderly.
Hi, I'm Charlotte and I'm the sister on Ward C6.
I'm Sudha Jain, Senior Sister on Ward G6.
Hi, I'm Hayley, I'm Senior Sister on Ward S6.
And I'm Georgina, Senior Sister on C4. Nursing in the Department of Medicine for the Older Adult on one of our 5 specialist wards will give you the opportunity to work with our patients over the age of 70 who have multiple and often complex acute medical and social care needs. If you're interested in working with an inclusive, supportive team where you're able to work alongside, learn and collaborate with other professionals from the wider multidisciplinary team, such as physios, OTs, dietitians, discharge planning. If you're inspired to provide high quality, holistic and dignified care to older people who have a wide range of both acute and chronic conditions, then Medicine for the Older Adult is for you.
If you join our team, you'll have the opportunity to enhance and expand your knowledge and understanding in a wide variety of medical conditions and their treatments. You will gain valuable clinical skills in managing deteriorating patients and acutely ill patients, cardiac conditions, sepsis treatment, diabetes, respiratory disease, tissue viability and wound care, nutrition and feeding, delirium and dementia care of the vulnerable people, pain management. Alongside these skills, you will also learn to enhance your communication and listening skills, manage complex social and family situations, and support those suffering grief and loss. How to enable patients to maintain or regain their independence and prevent them from deconditioning. You will gain insight into supporting and planning safe, timely discharges from hospital to a variety of other settings. You will enhance your skills in caring for frail elderly patients, provide professional, dignified care to those in the final stages of their lives, helping to support them and their families through these difficult times.
There are many learning opportunities and development for staff on care of the elderly wards. And for healthcare support workers, there is an opportunity to undertake the Nursing Apprenticeship Programme, whereby you can train to become a qualified nurse whilst working as a healthcare support worker on your wards. For staff nurses, we offer a preceptorship programme, and there are many competency packages both online and face-to-face for you to complete. You'll also be given a link nurse role to focus on and train and to educate the remainder of your team. Some quotes from some of the staff that work within the Department of Medicine for the Elderly. We get great job satisfaction from our work. We make a difference to someone's life on every shift that we work. There is great teamwork and we work together well under challenging circumstances. We love caring for older people. I love working on the ward that enables you to learn about and care for dementia patients. The staff are supportive and there is a great teamwork and great camaraderie. If you are kind, caring, compassionate, motivated to learn, and you are inspired to provide the best possible, up-to-date, forward-thinking care for older patients, then we would love to join our team and help champion elderly care, improve patient experience for the future, and make positive changes to how we treat and care for our patients. We will now pass you over to our colleague in P and Q2. Thank you.
Thank you. So hello, my name is Bethany. I'm the Senior Sister of the wards P2 and Q2. We look after 38 patients in total across 2 separate units with 18 beds each. So the idea of our wards, which opened only recently in May 2021, and then we moved from T2 to P and Q in December 2021, is that we look after patients who are medically fit for discharge. So all of our patients no longer need to be in the acute hospital setting, and they're just awaiting some sort of community support. So a lot of our patients are of the older generation and awaiting care packages at home or residential and nursing home placements. We will take all patients from all over the hospital, both medical and surgical, and as long as they are medically fit and no longer require any medical intervention, then they can come over to us. The idea of the ward is that we help ease pressure for the main hospital. So by offloading acute hospital beds, patients then come to us and ED can then be offloaded to those acute areas. We're currently quite a small team because we came from a smaller ward, so we would love to have some new faces with some new ideas and to get the ward fully established. I'll pass you over to some colleagues here.
Hi, my name is Desdo. I'm one of the new band 6s in the ward. I've just newly started a couple of weeks ago, and I've been welcomed by the ward, by the senior sister. It's been lovely working here in P&Q ward. So part of my job is to ensure a safe and quality nursing care to be administered to the patients, and I coordinated with the discharge planning team about the discharge plan of the patient, just to make sure that when the patient leaves the hospital, they are being sorted and the package of care is ready and available for them. Pass you over to Helen.
Hi, my name's Helen. I work on the bank, and I've ended up over here doing loads of my bank shifts. I absolutely love this ward. The teamwork is unbelievable. So if you want to come and work over here, please do.
Thank you. We'll pass you on to respiratory now.
Oh, sorry, Steve, I think you're just on mute.
Apologies, start again. My name is Steve Nay, and I'm the senior nurse on N3. N3's Addenbrookes dedicated respiratory care unit, and we're a 25-bedded unit that cater for all aspects of respiratory medicine. And we have a dedicated team of enthusiastic, experienced practitioners that provide high-quality care. So what can you expect to see on N3? So starting off with the most common ward admissions that we have, and these conditions fall under the COPD umbrella, such as bronchitis and emphysema, pneumonias and chest sepsis. We also look after a great deal of asthmatic patients, both acute, chronic and step downs from intensive care following life-threatening exacerbations. We also look after both types of respiratory failure, so type 1 and type 2. Type 2s, which tend to more often than not need non-invasive ventilation, and we do have quite a lot of that, including NIV management for neuromuscular conditions and diseases such as motor neuron disease. Something that is our bread and butter, obviously being a respiratory unit, is oxygen therapy and the management of this, including much more dedicated oxygen management in terms of nasal high flow. We do a fair degree of chest drain management for pneumothoraces and pleural fusions, so you'll get a good experience of that. A lot of tracheostomy management. That's my first love from respiratory. Management of pulmonary embolisms, pulmonary edema management, a lot of management in terms of intravenous antibiotics. We look after a lot of patients that have got lung cancer, from initial stages, investigations, through to management, diagnosis and treatment. We work alongside a big specialist MDT, pleural management, tracheostomy teams, the adult respiratory management team, as well as the wider MDT, speech and language, physio, occupational therapy. As I spoke about, we do a lot of oncology and palliative care of patients with end-of-life conditions, and we treat them in their last days with us in a dignified and respectful manner. And we do a lot of complex discharge planning. So that is N3 in a nutshell. And with that, I'll hand you over to the renal team.
Hello, I'm Laura. I'm the senior sister on C5, which is the renal ward at Addenbrookes Hospital. We're a 23-bedded ward consisting of nephrology and medical patients, and we do have some vasculitis patients as well. We've got a 5-bedded dialysis unit with 2 side rooms, which is used for acute dialysis. The dialysis is used for patients on the ward and other patients in the hospital. A lot of our patients have complex needs and complex discharges. We have biopsies that take place on the ward and line insertions which take place in an emergency, but mainly they actually happen in vascular access. We're a friendly team on the ward and obviously share our team with the MDT. I'd just like to introduce Terry, one of my healthcare assistants.
Hi, I'm Terry. I started out as a bank HCA. When I walked onto C5 for my first shift, I found it so friendly and encouraging from the staff. I actually became permanent. Once I've become permanent for a few months, I applied for band 3 position, which was from the encouragement of Laura and the other staff members. And I progressed again onto the nurse apprenticeship course, thank you. And I'm in my first term of that, which I'm really enjoying. I absolutely love it here and wouldn't be anywhere else. Thank you.
And this is Ditchley, one of my students on the ward.
Hello, so I started my placement on this ward a few weeks ago, and so far it's been a great experience. I was welcomed by kind and friendly staff who helped me in having a smooth transition from my previous placement onto here. As a student, I've had many learning opportunities. I got to watch and observe in tunnel line insertions, renal biopsies, lumbar punctures, and as Laura said, there's the hemodialysis, so I got to work in there a few shifts, and it was a great experience to widen my knowledge on renal function. Overall, I've enjoyed my time on C5, and I look forward to the next few weeks ahead working with the amazing staff.
Thank you. I'm just going to hand you over to the Cambridge Dialysis Unit.
Hello, my name's Owen, and with me we have John and Karen, and we work for the Cambridge Dialysis Centre and also work on site at the Addenbrookes C5 dialysis unit occasionally. We run a 36-bedded dialysis unit, not including a home therapy department, which a separate team are managing. And we cover a wide area under the whole Addenbrookes umbrella over East Anglia. So we have additional dialysis units at Hinchinbrook, West Suffolk and Kings Lynn, providing dialysis for a wide variety of patients. For those not familiar with dialysis, it's a procedure that a patient will undergo 3 times a week to clean their blood as they have little or no kidney function. Working with the dialysis team has offered me wonderful learning opportunities and wonderful development opportunities. I really enjoy the job as it contains a great combination of nursing care and technology in the dialysis machine. John.
Hey, John here. I work as a band 5 here in the renal dialysis unit, and I am proud to say that it is a spectacular team that we're working here with, an amazing work environment and great shift patterns here actually. Usually we operate the unit from Mondays to Saturdays with on-call covers from Sundays and night shifts as well. Usually on Mondays, Wednesdays, and Fridays, we have early, late, and twilight shifts to cover because we only operate from 7 a.m. to half 11 in the evening. And on Tuesday, Thursdays, and Saturdays, we usually have earlies and lates to cover just because the unit runs from 7 a.m. to 7 p.m. I'm going to say it is I'm very proud to be part of this team because it has developed my renal specialty here in the unit. And I get to work with some of the greatest minds in nephrology at the unit. It's also very fulfilling in terms of we impact patient lives very closely because we do see them a lot during their stay here with us. And even throughout their discharge after their stay at Addenbrookes and on towards transplants if they do, and onto end of life care if it does get to that. We eventually become family with our patients, and it is a very fulfilling and rewarding experience that we've got. I'm gonna pass you over to Karen, one of our members.
Hi, I'm Karen. I've been working in dialysis for 30 years. The team I work for is amazing, from the consultants down to the domestics. It's one big team. We provide excellent patient care and make the difference to many of our patients' lives. Seeing the same patients 3 times a week allows you to really connect with them, and it's a great place to work. With that said, let me hand you over to the amazing hepatology team.
Hello, my name is Kat Green. I'm the Senior Sister on Cambridge Hepatology Unit.
Hi, I'm Manos. I'm one of the charge nurses.
I'm Alice. I'm one of the student nurses.
Okay, so working on the Cambridge Liver Unit is a really exciting opportunity for all staff. We're a 30-bedded ward with 2 elective couches for patients to attend for day cases. The unit provides care for patients suffering from all varieties of liver disease, and we also accept referrals nationwide for various treatments and for liver transplant assessments as well. We provide an alcohol detoxing service as well as catering for day cases such as paracentesis, the drainage of abdominal ascites, and transplant biopsies as well for renal transplants and liver transplants. It's a really specialist area and provides varied opportunities to care for highly complex patient groups. And it gives a really fascinating insight into the physiological and psychosocial aspects of acute and chronic disease. The patients we care for are really diverse, and no shift is ever really the same. We have a large team of specialist nurses as well, providing care for specific conditions such as viral hepatitis, alcoholic liver disease, non-alcoholic liver disease, autoimmune hepatitis, jaundice, paracentesis care, and hepatocellular carcinoma. The team also provides a satellite surveillance service for hepatitis, enabling early detection and treatment with a proven reduction in the complications.
Opportunities for staff working on the ward include supporting the assessment process for the liver transplantation, management of acute alcohol withdrawals, management of acutely unwell patients that require administration of blood products, intensive fluid balance management, but also parenteral nutrition and electrolyte management. The ward is also supported staff undertaking the nursing apprenticeship, and we also have students from all stages of their course. Generally, the team is supported by a very dynamically multidisciplinary team who meets every morning and discusses patients in detail and create a plan.
Being a student on the Cambridge Liver Unit has given lots of learning opportunities with input from lots of different members of the MDT and specialist nurses. The staff are really friendly and knowledgeable about the speciality and always willing to help.
Cambridge Liver Unit is a challenging, fast-paced, interesting and extremely rewarding place to work. And on that note, I'll hand over to the Roy Khan Transplant Unit.
Hi, welcome to the F and G5. My name is Kate Pickley and I'm the Senior Sister for F5, the High Dependency Unit for Transplant.
And Ellie Pinkney, Junior Sister for G5.
The Sir Roy Khan Transplant Unit comprises of a 28-bedded G5 and a 5-bedded High Dependency Unit F5. We routinely perform organ transplants consisting of kidney, pancreas, liver and multi-organ transplants. It is one of only 2 national EPS centres in the country. We provide highly specialised care for our patients and have become one of the largest transplant centres in the UK. In fact, we were the only centre in the UK to stay fully functional in the pandemic. We are also the only transplant-specific HDU centre in the country. We did 296 transplants, transplanting 332 organs in the last financial year alone. It's a privilege to work in an area that provides the gift of life. The HDU team comprises of skilled nurses that are able to provide complete care for our patients on a 1-to-2 basis in a very exciting role. Both G and F5 look after transplant patients preoperatively, optimising them for complex surgery and postoperatively. We can provide great opportunities to improve your knowledge in managing deteriorating patients and caring for patients post-transplant.
F5 and G5 work closely together. We pride ourselves on creating a positive work environment that endeavours to champion and support new members of the team in order to promote professional development. Both the PD team and senior band 6 and 7 team will assist with professional development through means of ward-based transplant competencies and courses. It is a hub of fantastic opportunities that enables you to work closely with members of the multidisciplinary team. Specific learning opportunities include artificial feeding, both enteral and TPN, cardiac monitoring and inotrope support, hemofiltration, V60 and high flow oxygen management, pain management using PCA and epidural systems, PICC line, central line and arterial line management, simple and complex wound management including VAC therapy, ABG interpretation and specialist management of immunosuppressed patients. It's an extremely busy unit that enables nurses to enhance their critical thinking and work autonomously. You will develop skills surrounding the management of an acutely deteriorating patient and how to manage them effectively. We welcome anyone that wants to work on transplant and join our family. We will now hand over to Ward J3, Connor.
Hello everyone, my name is Connor. I'm the charge nurse up on J3. So J3 is the COVID ward within the division. So of course, coming to us, you become both experts in COVID management and a range of other specialties. So for an example, on the ward today, we have patients under medicine, orthopedics, neurosurgery, ENT, max-fax, transplant, oncology. So if you're looking to learn new skills, new knowledge in quite a fast-paced environment, then J3 is very likely the place for you. We're a very new team on the ward. So I like to think we're very friendly, accommodating of new ideas as we develop as a team. So if you're looking for somewhere interesting, ever-changing, then this is likely the place for you. A bit of background with J3, it's a 23-bedded ward. Patients tend to come to us to stay, whether they've come into hospital with COVID or perhaps picked up COVID in the hospital. For usually a maximum of 10 days, patients will stay with us unless they go home beforehand. So yeah, it's a very challenging at times, but very interesting. So yeah, that's J3 in a nutshell. I'll hand over to Salvatore from EAU4.
Hi everyone, I'm Salvatore. I'm the ward manager on EAU4, the medical assessment unit at Addenbrookes Hospital, and I'm here today to tell you the benefits of working for the emergency assessment units. The emergency assessment units that I'm representing today are built on their own block above the emergency assessment department, and they work closely together, but they are independent in their own management. EAU4 is the one that accepts patients straight from the emergency department, and patients will have their first assessment while in your care. On the other hand, EAU5 is the short-term assessment unit where patients will be stabilized before they will move to core wards to continue their treatments. Both the units are welcoming, supportive, multicultural and dynamic safe spaces for you to learn and develop your career, where your skills will be put to the test. Every unit counts 26 beds, 13 of which are monitored, and our patient group is very wide. We cater for patients requiring mental health, acute care, to those requiring CWA assessment, therefore alcohol withdrawal, or just the general fall and confusion. Sepsis is one of our main treatment that we provide on the ward. So if you are interested in caring for acutely unwell patients, feel free to call either of the ward to arrange a visit or just to ask a question. We are looking forward to hearing from you, and don't waste time, apply now. And now I'm leaving you with my colleague Marion in the discharge lounge.
Thank you, Selva. Yes, welcome to the Discharge Lounge. My name's Marion, and we currently have got vacancies, so we would love to hear from you. The Discharge Lounge, we've recently moved and are located on EAU3, and we have got room for 2 bedded patients and 16, sorry, total of 16, it's 14 shared patients. You will gain lots of experience with discharge planning. You need to have excellent communication skills. There's plenty of opportunities to develop your skills. We'll be linking in with all of the wards. We take patients from all over the hospital, not just Division C, it also includes surgical wards, A&E as well, we get quite a few from. We look forward to having you. Thank you.
Hi, thank you very much everybody for that update. So you've heard from a broad selection of our specialties in Division C, and I think what I want to pick out from what I've just heard are 4 words that we used repeatedly during those presentations, and they were exciting, friendly, welcoming, and even the word family was used. And this is an exciting, friendly and welcoming division to work in. So I really hope you choose us to come and work and join the Division C family. So thank you very much for listening to us.